Good evening, everyone. Once again, welcome to this session. My name is Njoki Washira and I work for Equalize Health. I want to welcome you all to the first session of the National Nurses Association of Kenya Telementoring series. So today's topic is about physiological support for nurses and midwives. Equalize Health has partnered with NNNK to bring you this online series. We have implemented several telementoring programs for health professionals just like yourself in India and in Africa. Our program works on the principle of the project ECHO by the University of New Mexico. So before we begin, let's start with a bit of housekeeping. Please keep yourself muted unless you're talking. Let's keep our videos on. It would be good to see you and interact with you. That is if it's possible. Please respond to the questions without hesitation. This is a judgment-free zone, and every case discussed here should be treated as an example to learn and to share. You can also post your questions on the chat box. And now I'd like to welcome Dennis to introduce the speaker for the day. Welcome, Dennis.
Thank you very much, Njoki, for the invitation. My name is Dennis Mbithi. I'm a national official of NNK. I'm the vice president of the organization, head of education and research. We are happy to have all the members on board today to start this telemedicine series. And I'm happy members have logged in. This will continue so that we can, all of us, gain knowledge together and improve on our outcomes to our patients. I want to say by the end of this series, you are going to get your CPD points for attending this telemedicine session. So feel much welcome and we're happy to have you on board. I want to take this opportunity, as I've been guided by Njoki, to invite our speaker. Our speaker is called Simon Githui. He's one of the nurses in this country, a renowned nurse. He's working at Dedan Kimathi University of Science and Technology. He is the head of department in that university, School of Nursing. He holds master's degree in mental health and psychiatry. He has a vast experience in issues of mental health and psychiatry, in management of patient and psychosocial support for clients and also colleagues. Simon comes with a wide range of experience to us, and today he's going to talk to us about the topic at hand. He's also a researcher. He's good in project grant writing. He's a PI of many projects, and he has published many papers on mental health and psychiatry and other disciplines. So we are happy to have him on board, and he's going to take us through his presentation. And I am happy to introduce to you, Simon, please welcome, say hello, and you can proceed. Thank you very much.
Thank you so much, Dennis Mbithi. Greetings, colleague. I'm happy to join you this evening, and I'm happy to share the presentations with you. Njoki, do you want me to continue the presentation, or do we have something else before the presentation?
Yes, continue. Go ahead, Simon.
Okay, thank you so much. Allow me to share my slides. Njoki, if you'd activate my screen from your end so that I'm able to share.
It's already done.
Yeah, you should be able to, so you just click on the share screen button on your screen. click on the green button which says share screen.
Yes.
Yeah.
It's coming up.
Perfect.
Okay. Let me know when it's okay from your end.
Yeah, it's okay. You can just put it on SharePoint. Yeah, thank you.
Okay, thank you for that help. I truly appreciate. To increase my bandwidth, I wish to not to share my video as I do the presentation, so that it's okay from my end. Just a minute. Okay, thank you. So colleagues, once again, welcome to our presentation this night. We are looking at psychosocial support for nurses and midwives. And I hope that all of us in the audience are either nurses or midwives, and probably we might have one or two other healthcare providers. I'm happy to present to all of us. We hope we are going to learn one or two things from the presentation today. The $1 million question is, who cares for the caregiver? Who cares for the caregiver? When patients have physical, mental, social issues, they run to us as nurses and midwives, and probably other healthcare providers. And the question is always when nurses are going through, especially mental and social challenges, who do they run to? Who cares for you? Who is interested with your physical, mental, and social health? Especially your mental and social health. Who cares for you? As we go through this presentation, probably that's a question each one of us will be asking themselves. So literature has stood as a few things. That one, that nurses and midwives experience psychological distress because of where they work, their work environment, their work culture, the volume of patients that they take care of, the volume of work at their disposal, the characteristics of patients they're taking care of. Because of that work environment and working culture, then you find that many of nurses and midwives experience psychological distress. Nurses and midwives continue to work even though they don't feel okay, even when they are feeling distressed, even when they are stressed, and they continue to perform their clinical duties, sometimes effectively, but because probably of the psychological distress that is going through, you might find that they might not be able to provide high quality nursing or even maternal care to the clients or patients they're taking care of. The emotional trauma that is associated with health care work often remain sometimes unrecognized, and most nurses and midwives often go unsupported. That is from Wilson 2015. So we have a nurse here, we have a midwife here who is working so hard to take care of their patients. They're doing everything possible to be able to support their clients and patients, but most of them would go through psychological distress, and nobody will notice that they are going through that. Nobody will recognize that, and sometimes they go, for long period of time without getting support from anybody. So, and also, as Strobel and others also noticed that nurses and midwives in psychological distress lack psychosocial support, and probably that is why NNK, together with Equalize Health, probably thought it would be nice to be able to look at psychosocial support of nurses and midwives, because literature already indicates as nurses and midwives, we are experiencing psychological distress. The work environment is a culprit. Many of us have this psychological distress, but it goes unrecognized, unnoticed, and probably no one provides care for us. So always the question is, who is caring for the caregiver? Who is interested with the mental health and social health of the caregiver? The term psychosocial refers to dynamic relationship between psychological dimensions of a person and social dimension of a person. So basically you would say that it takes care of everything psychological in us and everything social in us. Remember, when you look at the definition of health by WHO, it talks of three aspects of health: physical, mental, and social. But me and you know that we invest a lot in the physical health, but very little in the mental and social. So when you're thinking about psychosocial support, you're interested in the psychological functioning and the social functioning of a person. Psychological has to deal with internal, emotional, and thought processes, feelings and reaction of a person. The social deals with the relationship that we have with colleagues, relationship that we have with our friends, relationship that we have with family members, and also family and community networks that exist in our circles. It also deals with social values, culture, and even religious practices. Of course, religious being part of social and cultural practices that we engage with. And therefore, when you're thinking about psychosocial support, therefore, you're looking at all the actions that are carried out to address psychological and social needs of a nurse. Because the person in question today is the nurse or the midwife. So everything that is done by you, by colleagues, by our organization, by the social resources that we have in the community, everything done to be able to take care of these nurses' social and psychological needs is what we refer to as psychosocial support. And when you look at psychosocial support, it can be both preventive, at the same time it can be curative. When it is offered to be able to decrease the risk of developing psychological distress, then the psychosocial support in this case is preventive. But when you're offering the care to nurses who are already distressed, to be able to deal with what they're going through and overcome the psychological problems and distress that they're going through, then at that particular point is curative. I want to say here and now that as nurses and midwives, we not only require preventive psychosocial care, but also we require curative psychosocial care, because already we have said that literature indicates that actually many nurses, many midwives are actually going through psychological distress. And therefore, psychosocial support comes handy not only to prevent those who are not there, but also to take care of those who are going through the same. And then when you think about psychosocial support, the end result for this is actually to promote resilience in this particular nurse. When you think about resilience, is the ability to adapt to difficult situations when stress, adversity, or trauma strikes, right? It is the ability to withstand adversity and bounce back and grow despite life downturns. Okay? And this is what we want to be able to achieve with this nurse that we are offering psychosocial support. We need to be able to develop, create, generate, support their resilience so that they're able to bounce back once they are faced with all these causes of psychosocial distress. I want to say that there are so many causes of psychological distress, and the list I've provided here might not be exhaustive, right? Anything that will interfere with anyone's psychological health, social health, would actually be correctly attributed as a risk factor or as a cause to psychological distress. And therefore, when you think about our work environment in the hospital, when you think at the both physical, social, and psychological environment, when you think about our social environment at home, within the community, in social gathering and social cycles that we involve ourselves in, all that environment can actually contribute to the psychological distress that we're going through. So we are saying that when you're thinking about supporting any nurse who is going through psychological distress, probably your primary role would be to identify the etiology behind the psychological distress. And there could be a number of them. We are talking of heavy workloads. We know this is an issue that we always struggle with in our clinical setting, both in community and also in the hospitals. Heavy workloads, where you find the ratio of patients and nurse is extremely uncomparable. The number of patients you're required to take care of are quite high. Lack of adequate resources to work with. You find that you have a lot of work to do, but then you're not correctly supported to be able to do what you're supposed to do. So you find you're supposed to take care of a patient, probably going through a particular, maternal or nursing issue, and then you need to offer the care to the patient, and then you do not have the necessary resources. And when I was having a chat with Joki from Eco Health, she mentioned to me that they're involved in making sure that the instruments and the instrument that we use in our settings actually user-friendly. I was happy to hear about that because they are promoting, us having access to resources that you can actually use to take care of our patients. Lack of respect from other colleagues. I know we all know the fights we have with other colleagues, could be doctors, could be our fellow nurses, our fellow midwives, lab technicians, and all those healthcare workers who work in the hospital. Sometimes those competitions are usually sometimes not healthy, and because of that, then you find that that lack of good coordination, good relationship with other healthcare providers, then sometimes it pushes us to the ecological distress. Little input into unit decision making. You find where you are directly responsible to the care of the patient, but your voice in terms of what should be done to the patient, how it's supposed to be done to the patient, is very minimal. Job dissatisfaction, right? And this could be as a result of personal factors. It could be from job-related factors. It could be caused by many causes. You find when somebody is actually satisfied with what they do, and you can imagine waking up every morning doing what you're not happy doing, then you find that can actually affect their psychological well-being, and therefore you end up having somebody with psychosocial distress. Handling of difficult patients. The difficult here is in question, okay? Because we say that the environment that we are working in can actually be a source of psychosocial distress, and therefore when you're handling these patients probably who not appreciating what you're doing, sometimes because of lack of information or because of their own personality, that can push you to a situation where you have no way of getting out of that situation. And because of that, that can push a nurse or a midwife to get psychological distress. Sometimes the demands of the patients could be unrealistic, or sometimes the demands could be realistic, but again, there's not enough resources to be able to offer them what they're asking you to offer them. Inadequate clinical supervision and support, where you find that you have people you report to, people who are supposed to be taking care of your welfare, looking at how work is being implemented, what challenges you're going through, what type of support you require. And when that is lacking, then you find that then psychological distress can set in. Lack of adequate social support. And this social support could be coming from your colleagues, could be coming from family members, could be coming from significant others, could be coming from community resources, religious leaders, and all those social resources that are available to all of us. Sometimes that is lacking. The other one is underlying social and mental challenges. You might find already as a person or as a nurse or as a midwife, already you're going through social issues that are outside your work environment. Sometimes you could be going through a mental issue or a mental difficulty. It could be probably anxiety. It could be issues to do with depression. It could be anything. Okay, you could be going through a problem with interpersonal relationship, maybe with your spouse, maybe with your children, maybe with your neighbor, maybe probably with somebody that you met with, right? And all that can actually now push somebody to actually get into social distress. So all these causes, and these causes could be both physical, could be psychological, and even social etiologies or actually factors that can actually push a nurse or a midwife to be able to get into psychological distress. What are some of the warning signs that you can look for within yourself and also among your colleagues to be able to probably have an idea or have a clue that somebody is actually going through psychosocial distress? Some of them include sad mood, anxiety, or even worry. And sometimes when you're thinking about these warning signs, sometimes it's difficult to pick them out. And the reason is because most of us are happy to pick or easily pick physical symptoms. When somebody tells you have a headache, it's very easy for you to be empathetic to them and be able to understand what they're going through. When somebody comes to you and tells you, by the way, I'm feeling low, I feel like I don't want to do anything. I don't have the energy to do anything. I don't feel like I'm drawing any happiness from anything. I don't feel satisfied with what I'm doing. I'm feeling inadequate to do what I'm supposed to do. Sometimes it's difficult to appreciate that as a problem, right? Most of the time, such people are labeled as lazy, okay? Labeled as people who don't want to work. Probably they're given all type of labels. But if someone was to walk to you and tell you, I have a headache, I have a running stomach, I have high blood pressure, for example, it's very easy for you to appreciate what they're going through and actually empathize with them. But then when you think about mental and social issues, it's very difficult for anyone to actually sympathize and empathize with you. If you're to report to your colleague and you're a gentleman, for example, considering our culture, hey, I have an issue, I have an interpersonal relationship issue with my wife, they're likely to laugh at you or probably tell you, you're not a man enough. Okay? Why are you not able to handle your family, for example? Okay? So it's difficult, once again, to be able to, if you're not keen, it's very difficult for us to be able to pick these signs and symptoms, and it's difficult for us to be able to sympathize and empathize with those who are going through these signs and symptoms of psychosocial distress, and it's important for us to be able to watch this. From where I sit as a mental health nurse, I usually say that if you notice any change in a colleague or a friend, the change could be positive or negative, right? That change could be an indicator of a mental or a social issue. This is what I mean, right? If somebody probably eats a particular amount of food, maybe that is how they eat. Every time you eat with them, they eat a particular amount or a specific amount of food. Then all of a sudden, without any explanation, that amount has changed, either has increased or decreased. That's an issue that you need to be able to watch for. If generally I sleep at 10 p.m., wake up at 5, that is my general sleep routine. Then all of a sudden, I'm oversleeping or I'm not sleeping at all, I'm having insomnia. That should ring a bell that this person actually could be going through a mental or a social issue. So the list here might not be exhaustive. Again, there's just a few of the things that you might be able to watch so that you could have an idea that somebody is going through a psychological distress and might require psychosocial support. So sadness of mood, anxiety and worry, persistent preoccupation, and this could be a mental preoccupation. They cannot get specific types of thoughts, mental images out of their brain, inability to cope, and some degree of dysfunction. And here we're talking about dysfunctions in different areas. Dysfunctions or problems with coping with small or normal stresses that are work-related, that are socially related, that are, for example, school-related. Sleep and appetite disturbances. And the disturbances here could be either increased sleep or even decreased. Decreased or loss of capacity to enjoy things. Previously, somebody used to enjoy, watching a movie, watching a football match, going out with friends to eat, for example, and they no longer draw pleasure from those activities. Decreased energy, where somebody does not feel energized or they don't feel like they have the capacity to do anything. And sometimes that decreased energy can go to an extent where they are not able to even take care of their self-care needs, right? The other one is health wishes and suicidal thoughts, or even attempts. And I have analyzed suicidal thoughts because, like you all know, currently this is an issue in this country and probably many other countries. Okay? Suicidal rates are increasing by the day, and we need to be very keen and very careful to pick those cases before they actually implement and complete a suicidal attempt or even suicidal thoughts. Why I'm saying this is because you will agree with me, like I've already mentioned, that these cases are now increasing by the day. And I know some of us usually fear to ask somebody, by the way, are you suicidal? Do you have suicidal thoughts? Because they usually think that actually that can actually push the patient to complete the suicide. But studies have shown actually that is helpful to actually pick suicidal thoughts. But some of these suicidal thoughts and attempts sometimes are usually masked by the patient. And so you might also look at cues that could push you think, or actually cues that could actually indicate to you that somebody is actually suicidal. And in my own view from experiences in the area of mental health and psychiatric nurses, probably this is something we need to ask everybody, whether sick or well. whether a nurse or a doctor, whether a midwife or a lab technician, whether a pastor or just an ordinary member in the community. So issues of death, wishes, suicidal thoughts should be able to be evaluated and should be a warning sign to actually development of psychosocial distress. Marked tiredness after even minimal efforts. They feel so tired even after doing very, very little tasks, I would say. Reduction in activity or feeling of restlessness. Somebody is restless. They are not able to do what they used to do as to the extent they used to. Lowered attention and concentration, so they are inattentive. There's decreased concentration. Complaints of poor memory. They can't remember things easily. That could be an indicator. Lost self-esteem and also self-confidence. Feeling of helplessness and hopelessness. And sometimes they feel like there's no future. There's no, the world probably is not going the right direction. And sometimes they feel an emptiness in themselves and they think that they might not be able to have anything positive around them, within the world, and within what they do every other day. So they feel, and sometimes they feel helpless, like they're not in control over anything happening around them. So feeling of helplessness and hopelessness. Unexplained physical and somatic symptoms. And the word here underlined is any physical or somatic symptoms that cannot be associated with any medical cause could actually be something that can actually trigger you or actually point you to a person who is going through psychosocial distress. So any physical or any unexplained somatic or physical symptoms, and the word here is any unexplained, right? But of course, don't also label everybody as going through psychological distress. Somebody comes and tells you have abdominal pain, for example. Before you say that is psychological distress, it's important for you to investigate the cause or actually trying to look whether there's any medical explanation to the stomach issues that they are presenting. So before you label them psychosocial, then it's important for you to be able to screen so that you're able to be sure that you're not dealing with a medical issue. Okay, now how do we assess for psychosocial distress? So we can use what we call the distress thermometer. I know we have many tools to measure for vital signs thermometer, we have a BP machine, and all these other instruments that we use. But we also have a distress thermometer, and it is as presented on that particular screen. So you could ask somebody to rate their distress in a scale of 0 to 10. 10 is where they have extreme distress, and 0 is where they have no distress. Okay, and then apart from that, you could look at other psychosocial issues that the patient could actually, or the nurse or the midwife would actually be having. Okay, for example, you could ask them, okay, please indicate if any of the following has been a problem for you in the past week, okay, including today. Be sure to yes or no for each of them. So you're looking at issues of practical problems, childcare, housing, transportation, treatment decisions, etc. You're looking at family problems, dealing with children, dealing with a partner, all that. You're looking at emotional problems. Emotional here, you're talking about depression, fears, nervousness, sadness, worry, all that. You're looking at physical problems, appearance, breathing, eating, fatigue, fever, etc. So you're looking at their rating of distress, but also you're looking at accompanying symptoms of that distress. And you're talking about issues of practical problems, issues of family problems, issues of emotional problems. You're talking about spiritual and religious concerns. You're talking about physical symptoms that now accompany distress. Okay? And by doing so, then you can be able to have an idea whether somebody is going through a psychological distress or not. Okay? But remember, unless you're a trained psychologist or mental health and psychiatric nurse, probably you might not be able to know what they are going through, but at least you'll have an idea. This particular patient, this particular nurse, this particular midwife, for example, might require psychological. Why I'm saying this is because care also involves referral. Care also involves referral. So if you're not able to handle the case or take care of the midwife or the nurse who is going through this particular psychological distress, then you can also refer them. Joki, I don't know whether I'm still audible from your end. I saw like I had some interruptions of my internet connectivity.
Now you're audible. We can hear you loud and clear. Just keep going.
Okay, thank you.
Simon, can you talk a little louder? Actually, it's the voice is a bit feeble sometimes, and people are facing some hearing issues. So if you can bring the mic closer to you.
Okay. Okay, thank you for that feedback. I appreciate it. Okay, if psychological distress is not taken care of, then you can end up having a midwife or a nurse suffering from long-term effects of the psychological distress. And this could include acute stress disorders, post-traumatic stress disorder, depression, burnout, stroke fatigue, compassion fatigue, vicarious traumatization, and many, many other mental and psychological problems. Okay? So it's important for us to be able to prevent or actually cure the psychological distress by offering psychosocial support. Okay, before then we get to these mental disorders that might arise because of the psychological distress that a patient, but a nurse or a midwife would actually be going through. But importantly, in this particular lecture is the psychosocial support that we offer to those who are going through psychological distress. Okay, and this is care that can be offered by a colleague. This is care that can be offered by a counselor. This is care that can be offered by a clinical psychologist. This is care that can be offered even by yourself who is going through the psychological distress. So it's important for us to be able to appreciate this. So the list is long. I'll be able to focus on a few of these. The first one is to acknowledge and normalize the distress. To acknowledge and normalize the distress. And here, it is crucial for a nurse and a midwife to know that it's normal to have a range of emotions under psychological distress. It's imperative for a midwife or a nurse to appreciate it's okay not to be okay. Let me repeat that. It is okay not to be okay. So denying the presence of unpleasant emotions or attempting to ignore or suppress them completely may escalate the emotions inside and sometimes may even create barrier between the nurse or the midwife and with the family members of close confidence and even the different sources of help. Therefore, nurses and midwives should not rush into the suppression of emotion, but instead they should be able to acknowledge and view the distress as normal. The next one is acknowledge burnout syndrome. This is one of the major issues that comes when a nurse or a midwife is going psychologically. So,
Simon, we are still encountering a bit of breaking from your end. Kindly just get close to the mic or increase the volume or something. We are hearing you're breaking up.
Let me try to change and use my earphones and see whether that will be better. Okay, just give me a minute, a second to connect my earphones. Okay, please let me know whether that is better.
Yeah, I think that's better. Just proceed.
Okay, thank you so much. So the next thing that we need to be able to do as midwives and nurses is to acknowledge burnout syndrome. Okay, so working in healthcare environment can be very stressful, and all of you can agree with me on that. And burnout has significant impact on the quality of life and psychosocial consequences. Okay, if we are going through burnout. So acknowledging the risk of burnout may be a vital and a first step to seeking care for us as nurses and midwives. And positive coping styles in working places may be encouraged to create positive feelings, and motivating development in coping styles may also help in decreasing burnouts
improve communication, and even heighten occupational growth and health. So therefore, talking to colleagues and taking time out for engaging in personal hobbies may also be a way of lowering the burnout. Thus, nurses and midwives, therefore, we are encouraged to inculcate positive attitudes and coping mechanisms to lower psychological distress resulting from burnout issues. We need to watch for burnout and actually be able to seek help when burnout actually sets in. The next one is taking a break to release distress. So it is encouraged that sometimes nurses and midwives should be able to find time out of work. And in such times, it's essential to take an emotional break, okay? And this emotional break could be spent with a friend, with a colleague, with a significant other, with whom they can express, okay, the difficulties that probably they are going through at their place of work. It's crucial to understand that support from peer or significant others should be voluntary and non-intrusive, aiming to providing a listening ear and extend support and encouragement. So it's important for us to know when we are taking this break and when we are releasing this emotional distress and psychological distress that we are going through, who are we releasing this to? Okay, because they should be understanding and they should be accommodating and they should be encouraging to us. Okay, so sometimes sharing an emotional burden with a colleague who is going through the same crisis may help in the validation of each other's emotions and relieving mutual support to deal with the distress overally. Okay, but even when you do not have a colleague who is going through what you're going, as long as they're able to offer a hearing ear and empathize with what you're going through, that could be helpful to you when you take a break and releasing the stress. The other one is exercising and practicing relaxation techniques, and I'm sure all of us appreciate the role physical exercise like running, yoga, and others, the role they play in relieving psychological distress or psychosocial distress. Simple relaxation techniques like simple abdominal breathing, guided imagery are quite useful to help us relax. And these are things that we can practice. I know we are very good at teaching them to patients and clients, but I think it would also be important for us to practice the same because they're quite helpful to us. The next thing that we can do to decrease psychosocial distress is practicing what we call self-compassion. And I want to say that witnessing distressing events at our workplaces may lead to self-blame and guilt in nurses and midwives over the helplessness of the situation. Such emotions easily give rise to harsh comments on self. For example, you could have harsh comments about yourself and you could be saying to yourself, I'm good for nothing, I'm not good enough, I'm not good at helping others, all right? I did not do my best. That was my mistake because that the patient died because I did this and that mistake, etc. Self-compassion has three components. One is self-kindness, the other one is common humanity, and the other one is mindfulness. When you think about self-kindness, it's important for us to be kind to ourselves instead of self-judgmental or being self-judgmental. We need to approach our experiences with non-judgmental curiosity and emotional warmth and a willingness to take care of ourselves. The other component of self-compassion is common humanity instead of isolation. Embracing imperfection and making sense of our experiences as a shared human experience is critical for us. Recognizing and understanding other suffering is also key to also helping us understand our own suffering and distress. The other component is mindfulness. So we need to be mindful instead of over-identification. So turning our attention towards our thoughts and emotions as they are. And they could be positive or even negative emotions, and not holding onto them, nor dismissing them is critical for us to be able to improve self-compassion. So let us practice self-compassion. The other one is adopting adaptive coping mechanisms, adopting adaptive coping mechanisms. So the adaptive coping strategies may include socializing, performing leisure activities, actively seeking emotional support, positive reframing of the situation, practicing religious prayers, and even engaging in religious activities. So those are some of the positive adaptive coping mechanisms. But sometimes when you're going through psychosocial distress, sometimes as nurses, we go to non-adaptive coping skills. Some of us go to self-blame. Some of us might go to denying the situation. Some of us might go to in situations where we want to avoid the distress. Others might socially isolate themselves. Others might get into alcohol and abuse of other substances, and those might not be the correct way to adapt to the psychological distress that someone is going through. And sometimes, depending on how someone is adapting to the distress, could be actually an indicator whether they're going through a psychological distress, okay? So if I have a colleague from all of a sudden, they are now over consuming alcohol, and before they didn't used to do that, maybe that could be an indicator. Maybe they are using non-adaptive coping mechanisms to what they're going through. And that could be a starting point for you to screen whether they're going through any psychosocial distress. The other one is activating existing social support. It's important for us as nurses and midwives to remind ourselves that we are not alone in this journey. Okay, we have colleagues, we have family, we have significant others, and we have many community resources that are available for us to be able to help us overcome psychosocial distress. So when in psychosocial distress, then let us reach out to these social resources. And sometimes it is okay to be able to receive care, okay? Even if you're a qualified, for example, a psychiatrist or a qualified mental health nurse, a qualified psychologist, a qualified social worker, it's important to also receive care from others. And also, it's important to seek professional support. And I know it's very easy for us to walk in to a consultant and for example, ask for a medical review or for a medical care. But I know most of us have issues, seeking professional counseling or professional psychological care. Very difficult for us to be able to do that. So it's important for us to appreciate. Then psychologically working towards a safe working culture and promotion of nurses and midwives, emotional well-being and interpersonal support as well. Okay, instead of having interpersonal wrangles, probably we need to be able to encourage interprofessional collaboration and supporting of each other. When you're caring for somebody going through psychological distress, we can use this simple model to be able to help them. And remember, we have social support. This includes the patient or the nurse, the midwives, and the family. Then we have the provider team. This could include you, colleagues, counselors, and all that. So you need to form a partnership with whoever requires the psychosocial support. And then you identify the psychosocial needs that this person could be going through. And then after that, develop an implementation plan, okay, that will be able to provide personalized information, identify strategies to address the needs, provide emotional support, and help
Simon, if you're speaking, we are unable to hear you.
Sorry?
Yeah, now we had lost you for a few seconds. Please continue.
Okay. Simon, we can't hear you. Now we can hear you continue.
Okay, okay, thank you so much. Okay,
from
thank you
the
so much.
previous slide. All right.
Okay, okay. I was saying that when you look at how we offer this psychosocial care to midwives and nurses, it's important to have a collaboration between the patient here represents the nurse or the midwife, and also the provider team. The provider team could be you as a colleague, it could be a counselor, it could be a clinical psychologist, it could be a psychiatric nurse, etc., etc. And then you form a partnership, and then you identify the psychosocial needs, and then you implement strategies to take care of those psychosocial needs. And as you're doing this, you're linking this particular nurse or midwife to family social services that are available for them. And then you're also coordinating not only psychological care, but also biomedical care that they could need. And then finally, you need to follow up the care and even reevaluate to see whether you've been able to take care of that particular patient. Okay, and Njoki, if you allow me, then I can present the case study that we have for today.
Please go ahead. Go ahead.
Okay, thank you.
We lost you there, Simon. Simon, are you there? Yeah, I think we lost him there. Just give him a few seconds for him to get back.
Yes.
Okay, sorry, am I still audible?
Yes,
Yes.
you are.
Okay, okay. So this is the case study. These are the questions. So
Simon, the screen is lost, so you may have to share it again.
okay. Let me do that right away. I hope it's okay now.
Yes, it's coming.
Okay.
Thanks.
All right. Those are the questions we have for the case study.
Simon, you'll have to go back on the case study because we didn't hear the part of the case. Yeah.
All right. We're saying that we have midwife X who has been working at Hospital Y for the last 10 years, and they have been in labor ward. The volume of work in that unit is about 20 deliveries per day. Last week, she reports to have had a maternal death while on duty. This is the second case in a span of 4 months. She presents to the counseling department today with complaints of headache, lack of sleep, difficulties in relating with the spouse, and the complaints have lasted for the last 3 months. The question is, what more information would you seek from Nurse X? What do you think Nurse X could be suffering from? And 3, what supports does Nurse X require?
So put your answers in the chat box so that we can see if we understood the case. Yeah, I can see some responses coming. Please keep them coming. Yes. So in the chat box, we have a few responses. The first one I can see is psychosocial stress. I can see also someone suggesting the days off to recover and relax. I think that is in response to the second question. And then we have, I think, stress also for the first question. What is the patient or the nurse suffering from? We have working hours and shifts. We have he requires leave or sick off. We also have PTSD. We have sleep hours. And we have a response here from Peter who's saying you can ask about what did the management do about the maternal death? Was she apportioned blame? Also, she asked for a rotation in other units. And then there's also another one saying how many hours does she work and the kind of shifts. So I believe you can give us a response, Simon.
Okay. Yes, I think I'm still audible. All right. The first question is, what more information would you want from NAS X? And I want to go this quickly because of the interest of time. One is we might also want to find out what other accompanying symptoms that NAS X have. Okay, what other accompanying symptoms? All right. Do they have other warnings of mental or psychological distress, and even other physical symptoms as well? Then the other one is look at the workload at the place of work. We only know that deliveries are 20 in a day, but the question is how many nurses are there? How many other healthcare professionals are there? What is the workload looking like? Okay, in that particular unit, do they get offs? Do they get leave days? Do they get enough time to rest? Do they have flexible shifts? You're looking at the workload that can actually result to burnout. Medical history is also important. Remember, she's coming with physical symptoms, and those physical symptoms could actually be attributed to actually a medical disease and not necessarily a psychosocial issue. Okay. You could also want to look at more details on other work and other environmental stresses. There could be more than what she has presented with. So you look at other work or environmental related stresses that could be happening in the life of this particular nurse. Look at more details on social challenges, especially interpersonal relationship. She mentioned an issue with a spouse, relating with a spouse. Look at social issues around her life. And why you're doing this is you want to try and look or actually identify the trigger, identify the cause, identify the etiology of what she's going through. Right now, after doing that, what do you think Nurse X could be suffering from? Definitely, I agree with most of you. She's having a psychosocial, a psychological problem that she's going through. Okay, of course, that will have been ruled if we have ruled that should be ruled. That particular conclusion should be made after ruling any medical cause of the symptom that she's presenting with. Then now you come to the psychological issues that could actually be giving her the physical symptom that she's presenting with. What support does this particular nurse require? She requires psychosocial support from colleagues, from the hospital, from counselors, from clinical psychologists, from the family, from the social resources available to this particular nurse. Because remember, psychosocial support include both psychological support and social support. Thank you, Njoki.
Okay. Thank you very much, Simon. There's also one question that is being asked here in the chat that I would like us maybe to just talk about. There's somebody asking, what if suppose the distress is coming from family, and in the management you talked about partnership with the same family during management? How now?
Okay, interesting. Remember, we live with families, we live in a community, we live in a social setting, and importantly is to pick the etiology. If the etiology results, for example, from interpersonal issues with the husband or with the children or with significant others, maybe that's why you need to start actually handling the case, helping this family member who is already having a psychological issue or is the source of the stress, right? Because even if you take care of this nurse in the clinical setting and then send her back or send him back to the same social environment that is toxic to them, then you might not be able to achieve any significant positive recovery, I would say. So then you need to go deep down to where the problem is. And if the problem is coming from the family members, then you need to basically handle the family members first before you handle the nurse, because you release him back again to the same family. Thank you.
Okay. Thank you very much, Simon, for that interactive and very informative presentation. Now, I'd like us to find out whether we have retained some knowledge from the presentation. So I'm going to run the poll and give you a few minutes or a minute to answer, and then we can just see whether we were able to answer some of the questions that were in the presentation. So I'll give you 1 minute to do the poll that is on your screens. Okay, I can see 66% of us have participated in the poll. I would like us then to get the answers from the poll. Simon, can you see the questions on the poll?
Sorry, Jackie, come up again.
Can you be able to see the poll that I am sharing?
Yes, I can.
Yeah, so now you can take us through and give us the correct answers and a bit of explanations on the choices.
Thank you so much. Okay, the first question is psychosocial support means. The answers were means action that address both psychological and social needs of individuals, families, and community. Means interventions aimed at curing mental health problems. Means interventions at reducing mental health sickness. The answer was A. When you think about psychosocial support, we said it's both preventive and curative, and primarily it takes care of psychological and social needs. In this case, we are talking about the midwife or the nurse, all right? So anything that is psychological that is geared towards reducing psychosocial distress would be considered to be psychosocial support. Okay, they are not aimed at curing mental health problems, because mental health problems will require more than that, might require antipsychotics, etc. Antipsychotics, ECT, electroconvulsive therapy, and other interventions. Means intervention to reducing mental health sicknesses. Again, mental health sicknesses could be biological, psychological, and also socio-cultural. So you need more than psychosocial support to be able to reduce mental health illnesses. The next question was, which of the following is not associated with workplace stress? Answer A was high workload, job insecurity. C was supervision from the in-charges. And the answer is supervision from in-charges. Supervision, if carried well, is one of the ways of monitoring what is happening to the nurse, what is happening to the midwife, and actually even would be a good tool to be able to pick Okay, those people who are having challenges, there is need for resources, those who are going through psychological or even physical problems. But when you think about high work volume, when you think about job insecurity, all this can actually cause a lot of stress to the nurse and to the midwife. But actually supervision is one of the principles of management and should happen as per the principles of supervision. 3, yoga and exercise dash psychosocial distress management technique, religious, physical, social. So yoga and exercise fall under physical. Of course, religious and social care is very, very important in management of psychosocial distress. But when you're only focusing on yoga and exercise, then those are physical. Question number 4 probably gave a lot of many of us some problem. Question 4 was, one response to stress in the workplace is presentism. This may include 1, working longer hours, not taking holidays, all of the above. The answer is all of the above. I did mention during my presentation that when you're looking at psychosocial distress and mental and social or indicators of mental and social problems, the problem could either be positive, the indicator could either be positive or negative. If, for example, you report to work, for example, from 8 to 5, just an example, and then somebody starts, reporting from work at 6 and leaving very late in the evening, that already is an indicator of psychosocial or psychological distress. All right. So working longer hours and not taking holidays, wanting to be there, overdoing what they're supposed to do is what is called presentism. From the word present, they're always present, they are overdoing, because we said the psychosocial issues could be seen whether the habit is overdone or not done at all. Thank you, Njoki.
Okay, thank you very much, Simon. Sorry, we might just go slightly over time. Kindly bear with us. Now I'd like to invite Dennis just to say a closing remark and also, to tell us more.
So thank you, Joki, for guiding us, and thank you, Simon, for the nice presentation. We as NNK, we are excited to have our members and nurses and midwives get the knowledge about psychosocial support. And we are looking forward to have this series of telemedicine with our partner Equalizer every week. We need to remember we'll have another one on Friday or first, isn't it?
Yes.
Time like this. Let us join so that we can have more, gain more knowledge. We'll share CPD points in our chats and in our email. We are going to share it away. There's a code which we will give. You go to the NCK website, there's live event, you enter that code and you get your CPD point, which will help you in renewing your practicing license. If we continue these telemedicines, by the end of the day, you'll find within 1-2 months, you have attained your 20 points. So I want to recognize our president who is here, Mr. Collins Ajwang. I would like him to say something just for 30 seconds. And then from there, we'll have a closing remark from the Equalizer and we'll be done. Thank you. Mr. President, are you there?
Yeah, thank you. Thank you, Dennis, for the welcoming and guiding the process. Since we started, I want to thank Equalizer for the opportunity they have given to NNK and its members to benefit from this webinars. And I think this is awesome. I want to appreciate the presenter for the wonderful presentation. I think I actually has captured most of most of the things nurses always go through in our workplaces. There's a thin line between actually the assessment and how we feel and analyzing, and we as nurses need to analyze to know actually this person is undergoing psychosocial stresses. So I think this was a wake-up call and a good presentation to us nurses. I want to thank the nurses who have joined in this session, and I want to encourage them to continue doing so. Through the leadership of the second vice chair, we'll continue offering these sessions in conjunction with Equalizer. And I want to thank the NEO who are here and the NEC members for mobilizing members and reaching out to members to join into this session. Otherwise, thank you. And we are really looking forward to another presentation soon. Thank you.
Okay. I just want to say thank you also for attending this session and taking your time to learn. Thank you very much, Simon. That was a very informative session, especially at this time and era when most of us or most of people are having mental health issues. And at least today we can say we have had a milestone in terms of mental health. A bill has been passed, and we hope that it will be implemented and will be of benefit to all of us. So thank you very much, NNNK, for giving us this platform to be able to share with all the nurses within your membership and without your membership, so that we can be able to spread the word around and improve our health outcomes in our country. So let's meet again on the 1st for our second session, and in future we'll have more and more sessions. Thank you and good night. Good night.
Thank you.
Bye-bye.
Good night.